Runner's knee or patellofemoral pain is the most common running-related injury. It actually happens in 26% of runners. That means 1 in every 4 runners will experience runner's knee at some point in their running career. So what is runner's knee? Runner's knee or patellofemoral pain refers to pain either around your kneecap or behind your kneecap. And of course, you can have both areas having pain concurrently. It's typically caused when you spike your training load. So that could be increasing the volume, so too much distance, trying to go for longer runs and progressively spiking that load. And it can also happen because of increases in pace, so trying to progressively get faster too soon. And of course, it can be both together, such as bringing in faster runs on a longer run, like marathon pace, long run. The second causative factor will be your running biomechanics. So if you're overstriding, if you have contralateral hip drop, where your hip starts to drop and then it causes your knee to cave in, that's going to be a factor that's going to increase forces going through your knee joint. And then lastly, it's going to be related to a lack of strength. A lack of strength in your quadricep muscle, which is your primary shock absorber, a lack of strength in your lateral hip, which helps you give that hip stability, and then a lack of strength in your hamstring, which is crucial for deceleration every time you hit the ground. Those are your 3 primary causative factors when dealing with runner's knee. There are also other genetic factors like the shape of your kneecap, family history, that can also play a factor into runner's knee, but these tend to have a smaller role compared to training load, running biomechanics, and strength. So let's talk about the signs and symptoms when it comes to runner's knee. Number 1, the location of pain. Pain location is typically around the kneecap or behind it. It's tough for you to palpate behind your kneecap, so have a poke around your kneecap and understand if that is your area of pain. Number 2, your range of motion. Do you have any disturbances with your range of motion, especially as you are bending your knee? So if you're lying down flat and you're sliding your heel towards your bottom, does that bring on any pain as you're adding flexion and bend into your knee? And number 3, try and test it out with a combination of a squat, a single leg squat, or a decline single leg squat. Each of those movements are progressively adding more load to the knee joint itself and the patellofemoral joint, which is your kneecap. So those are the most common signs and symptoms when dealing with runner's knee. You can also get a bit of morning stiffness, that's going downstairs or walking down hills. You can also get it with running down hills as well. But it's important to piece everything together. Your history has to match up with your assessment. And your assessment sometimes is not always going to be pain provocative because your symptoms might come on 10 or 15 kilometers into a long run. So it needs a lot of irritation and loading cycles to bring on symptoms. So make sure everything adds up. And then most importantly, get some professional help. An orthopedic consultant, a sports medicine doctor, a physiotherapist, or a health professional in your home country.